Dance movement therapy is a form of psychotherapy that integrates the mind, body, and spirit, that really looks at the whole person. We really believe that there's an interrelationship between the mind and the body, and that what affects one affects the other. So we work both verbally and non-verbally. We work with the whole person, and we can start through the movement, or we could start with a verbal. But in changing one aspect of a person, you're really changing the whole aspect of the person. I think one of the things that bring all of the students here on some level is that they've experienced the power of dance in their lives as a sort of healing, transformational modality.
From kindergarten on up through when I graduated college, it's desks and rows and vertical, Grids, yeah, exactly. So actually to have a classroom space in a circle was a huge thing for me. I thought it was so wonderful to be able to actually exchange ideas and to move with these people I didn't know who they were, and you kind of develop this connection.
One of the really wonderful things about Antioch is we have a community. We have a lot of community spirit. The group of students get together, they have potlucks, they go to dance performances together. We have a dance performance every year that the students choreograph. So the students really work very closely together, and they help each other with assignments. And we're a cooperative versus a competitive model. It doesn't matter if everyone gets A's or B's. Everybody's working together, and they want to help each other.
The nature of what we're learning about is really intimate, and so as a group there's 9 of us in our class, and we've gotten really close through everything that we're learning about, and it's been really great. I didn't expect to go through the process myself, but also be like a real witness to everybody else going through the process and learning what everybody else is interested in, and then thinking about maybe I'm interested in that, and seeing how influenced I am by the conversations that we've had. It's just a really great environment to learn, where it is like in this kind of circle setup where we're all exchanging ideas, and it's not so stiff.
Dance is the language of this work. It's the vocabulary of this work. You need to be able to match a client's movement. You need to have a sense of where they need to go next in movement, of what they're missing, and you need to be able to help them get there. And technique sort of gives you those pieces, the language of movement, and the broader your background, the more you're going to be able to work with different kinds of people in different kinds of settings. So we do a movement interview that helps us assess, and sometimes people without years and years of training are just fine. They can move expressively, they can relate to other people through movement, and they move in many, many different ways.
Our students have done really well at getting jobs. We do have this mix of being able to be licensed as a mental health counselor in many states, and also some students have the alternate route in drama therapy as well as the dance therapy. So a lot of students use those skills, and they can get jobs in a lot of settings. So we've had students work in the prison system, we've had students work in daycare treatment, we've had students work with young children, we've had students work with kids with autism and centers for autism. We've had really high-powered jobs working in agencies with the most difficult adolescent boys. I think our students have bridged all the age groups, all the populations, and the work is effective. So people are very impressed with what our students can do.
Our classroom setting it's so movement-based and experiential-based. So much of our learning happens by doing what it is that we're talking about and what it is that we're studying. It's actually getting out there and trying it, which is so different than sitting and writing notes about what it is. So,
But it's really the only way you can do it.
right.
So
Yeah.
you gotta throw yourself in there.